Well, legal repercussions could be on the way following allegations of sabotage of the chiller system at the country's premier hospital. The Public Hospitals Authority announced Friday elective surgeries were temporarily suspended to begin upgrades to the chiller system after a possible sabotage. Before the weekly cabinet meeting this morning, the Minister of Health explained how they arrived at this conclusion and shared what comes next. Cleopatra Murphy has the details.
Minister of Health, the Honorable Dr. Dwayne Sands, says charges could be pending if a police investigation that is currently underway proves chillers in the critical care block of the Princess Margaret Hospital were indeed sabotaged. President of the Bahamas Public Services Union, Kimsley Ferguson, has demanded that proof of any sabotage be provided, as his members were being used as scapegoats when a lack of maintenance is the cause of the chiller's failure. Sands, who says no member of the BPSU was called up by him or the P.H.A., responded outside cabinet.
We have made a decision that the results of the investigation, if there are findings and if there are recommendations for prosecution, we will proceed to prosecution. And justice should be served. So let the chips fall as they may, no matter who it is that's involved.
The Minister of Health says officials have evidence for the claim and all information will be turned over to police. He also acknowledged there is some merit to claims that maintenance crews do not have the tools readily available to maintain the units.
The management of the complex at Princess Margaret Hospital and all the P.H.A. hospitals is multifactorial. There have been issues about availability of supplies, funding, and so on and so forth. But that in no way explains what has happened to the cooling system.
Sands confirmed the temporary chillers were ordered and will be installed at a cost of $20,000 and cost $8,500 per month for 5 months. They are presently at the Princess Margaret Hospital, having been delivered Tuesday morning.
So orthopedics and vascular surgery as a routine work every weekend to reduce the backlog. And so now this has created yet another issue for patients waiting to get certain procedures done. The medical teams certainly have tried to keep the levels, the backlog, the waiting list down. This has now bumped it back up, and we're going to have to determine how that can be most effectively managed.
Sands could not say how many surgeries were disrupted because of the failed units. It will cost an estimated $1.2 million to replace the chiller. Cleopatra Murphy, ZNS Network News.